Broadcasting from the business capital of the world, this is the Podcast Business News Network.
Well, it certainly is something that challenges many of us, and you may even have it and not even know. I'm referring to autoimmune diseases. So many different types can be chronic in terms of the symptoms and the challenges. Maybe you're on meds. Have you thought about acupuncture? Yes, that can support it, along with so many other things. We're going to talk with our professional of the year. She is our expert in that category of not just acupuncture, but also Chinese medicine. She's based in New York City. She is Dr. Kelly, and she's back with us. How are you today?
I'm doing good, Steve. How are you doing?
Fantastic. And like cancer, I'm pretty certain that if we think about it for a moment, we know somebody with an autoimmune disease or somebody who's connected to somebody else that is dealing with it, has dealt with it. Uh, it seems like there's more and more cases diagnosed every year. I don't know if the testing is different and that's why that's coming up. But where do we start with this? I had no idea that this could support.
Yes, actually, I got a patient recently who is referred by another patient, actually. So, this patient got PMR. So basically, PMR stands for polymyalgia rheumatica. It is an autoimmune disease. Patients can have like pain and stiffness in the major joint, like shoulder, hip. This patient, she said she got second dose of COVID vaccine in 2020, around that time. 10 days later, she suddenly just feels stiff and pain. She couldn't even get up from her bed.
Mm.
And it's so painful and stiff. So she went to her medical doctor, then they diagnosed her PMR, which is autoimmune disease. And usually for autoimmune disease, doctors don't really know the cause. So it is unknown. But it's pretty painful and uncomfortable because you're so stiff. You are not flexible. You cannot really walk or do things. So she has been on medication, corticosteroid for that. Recently, she started to see me. I gave her acupuncture, and she felt better.
Mm. Is that the case with many autoimmune diseases or challenges that there isn't typically a cure for a lot of them?
Usually for Western medicine, the cause is unknown. Basically, we don't know the cause. That's what usually the doctor tell the patients. But in Chinese medicine, actually it's it's kind of like much simpler compared with Western medicine because in Chinese medicine, like just inflammation. If people have some pain and have some stiffness, usually that is caused by the qi and blood stagnation. So in that way, of course, there can be underlying problem like kidney deficiency, right, or spleen deficiency. But one of the one of the diagnosis is qi and blood, qi stagnation, blood stasis. So in that way, doesn't matter what kind of cause or diagnose, we basically use acupuncture to move the qi, move the blood. So in that way, the patient will feel the pain relief.
You've referred to it many times, so I believe it's got to be very impactful, but stagnation in the blood. That seems to be the baseline for Chinese medicine of whatever we do within Chinese medicine, especially acupuncture, is going to move the blood, I guess, keep the flow, better better energy within the blood, if you will, the qi. What's going on there with the stagnation of the blood?
So for this patient, she said that she got the vaccine, then after that she got this. I'm not seeing anything the vaccine linked to this PMR. It's sometimes like it could be like people getting a little bit older. Usually PMR happens to people a little bit older. Not like fibromyalgia. Fibromyalgia can happen to any age, but PMR.
I think we lost you on the Wi-Fi connection there. Waiting for Dr. Kelly to come back. And what we're going to do, we're going to take a very short break and reconnect. We'll be right back.
This is a car. No matter how much you kiss your lucky frog, wish on a star, go far.
Protect yourself now against expensive auto repair bills. Call CarShield for a free and instant protection plan quote. Once your car breaks down, it's too late. Call 800-908-6126. 800-908-6126. 800-908-6126.
We're back. We're talking about autoimmune diseases and how acupuncture can support them with Dr. Kelly out of New York City. She's our professional of the year, and we had a little Wi-Fi burp, if you will. So back to stagnation of the blood. It just seems like this is such a major thing in Chinese medicine, and we've talked about it a couple of times before. But can you break that down for us? Why that is such a major focus, stagnation of the blood?
Yeah, so usually people who have PMR, people may have like qi stagnation, blood stasis. That's why people feel the stiff and pain. Why? Why people have qi stagnation and blood stasis? It could be from aging, could be from you just sitting over there for a long time, or you doing something in one position for a long term, or it could be from emotional stress. It can be a lot of reason, but it doesn't matter what kind of cause. As long as you feel stiffness, you feel pain, there is some stagnation over there. The good thing about acupuncture is as long as the needle inserted into the acupuncture point, usually people will feel the qi moving, the blood moving, people will feel better. And it even happened to a lot of my new patients. They never did acupuncture before, but after the needles inserted into the acupuncture points, they said, "Oh, Dr. Kelly, I feel something moving." Is that normal? I said, "Yeah, the qi started to move." We have a lot of qi stagnation, blood stasis from work, from job, from, housework, or from emotional stress. We are under a lot of stress. Usually our qi kind of like stagnant, cannot really move. People may experience this when you have a deadline due. You may feel like you cannot even breathe. When you feel in that way, your qi is stagnant. So that can cause the stiffness, can cause the pain.
Wow. See, I can understand stagnation of the blood. Let's say you have an injury and something pulls in a certain area, and starting to learn that, when you have shoulder issues, rotator cuff or whatever, there's going to be not a full flow of blood. So I see that. Relating it to other issues like autoimmune diseases, never would even imagine that that would be a cause. Is it the cause of autoimmune diseases, or it's a symptom or a byproduct of it?
Well, in Chinese medicine, right, we have different diagnoses. Like for example, qi and blood, qi stagnation, blood stasis. It can be underlying, like people have kidney deficiency or spleen deficiency. So the spleen deficiency, kidney deficiency is the kind of like root. Then the root generates the symptom of the kind of like qi stagnation, blood stasis. Then people have the pain or stiffness. So in that way, doesn't matter is what kind of cause. We move the qi, move the blood. Of course, when people have kidney deficiency, we tonify the kidney. When people have spleen deficiency, we tonify the spleen. And also there are a lot of points, acupuncture points can also boost the immunity. For example, there are the very, very popular points like on the lower leg called stomach 36. In Chinese pinyin, it's called Zu San Li. Basically, a long time ago, people say if you do that points, you can walk 3 miles more, no matter where you go. So basically, that points can boost immunity, can give you like a stronger qi and blood. You have better energy. So in that way, if you get acupuncture, the only thing is you will feel better and better.
Wow. Would you say that we all have stagnation in our blood? All of us, but when it's too much or it's in a certain spot, that's where the issues begin?
Yes, see, you are right. We all have a little bit, like qi stagnation, blood stasis. We all have a little bit deficiency, like spleen deficiency. That's why some people feel bloating, gassing. We all may have a little bit kidney deficiency. That's why some people have like lower back pain or low back soreness. Um, Especially when people get to a certain age, it kind of like speed up. When you are younger, you are like, you know, even you have a little bit of deficiency, you don't feel much. But when we pass a certain age, like people after 30 years old, if they still stay late every day, they even say, I just don't have enough energy like when I'm 20s. So let's apply to everyone. So you are right. Everybody has a little bit stagnant.
So, deeper question here. And I'm going to ask that question because I think many would be thinking it, especially when it comes to needles and their aversion of acupuncture. And I understand it. But of course, we've identified before the needles that you use in acupuncture are so fine like a hair. You could fit multiple of those needles in the needle that they draw blood from. That's how tiny they are. When you put the needle in for any goal, are you physically connecting with the stagnant blood? I don't know if that makes sense, but I'm trying to get the visual of what's going on when you're trying to destagnate the blood.
I think to this question, I will say yes and no. Yes, it for some local pain. Like for example, I had a patient who have frozen shoulder, like severe, severe frozen shoulder, couldn't put her hand on the bag at all. She first she got the cortisone shot, like 2 injections. She said first one, they insert superficial. She didn't feel anything, didn't help about her pain. Then she got the second dose of injection. They injected into her bursa. That injection helped relieve some pain, but she said the doctor said that injection should let her don't feel pain for like half a year. But after 3 months, she said that the pain came back and it's doubled. It's way worse than before. Then she came to me. So I really put a very long needle. But that's just for her condition. Not everyone I will use a long needle because her pain is so severe. She literally couldn't use her left arm at all. So I put a very long needle. Then I use the needle. I do some technique to move the blood stasis over there. So when I doing it, she did feel the pain. But after that, she feels so much better. She can put her arm on the back right away.
Wow. Was that how many treatments was that?
For this one, so the first time I didn't really use long needles because long needle first it looked a little bit scary. Second, when I work on it, if people have severe blood stasis, it's gonna feel a little bit of pain. So last week actually was the third time. But it was first time I used such a long needle. And so to answer your question for the local blood stasis, yes. if you have a severe blood stasis, you have the fascia and the muscle kind of like stuck together. You have the scar tissue over there. When I work on it, you may really feel the pain, but after that, you feel so much release. But for other point, for example, I talk about the longevity point, stomach 36, right? The Zusanni. That point can boost your immunity, make you like stronger. For that point, it's not really there is like local blood stasis over there, but after I put in the needle on that point, the qi and the blood just flow around your whole body and not just local. So that's my question. I said yes and no.
Interesting. Wow. Um, have you had stagnation of blood? Areas that you've defined?
Did I? I think I may because one day I got up. Actually, I didn't really got up. I woke up, then, I check my phone, right? Because patient, you're scheduled with me from text message, check my email. I was laying down on the bed with the phone in my hand. So my neck is not really supported by the pillow very well. So after I played the phone for, I don't know, like half an hour or 20 minutes, after I got up, oh my God, I feel the pain in my neck. It is so painful. And I know the reason because I lie down on the bed, play the phone. That's the cause. So to answer your question, yeah. So that is the blood stasis over there, and it's a sharp pain. I couldn't turn my neck. It's so painful. I have to do acupuncture right away on the neck locally. So, but good enough, the pain went away. So I was able to go to my office to treat the patients. So yes, I did.
Oh my gosh. How many of us feel things like that from time to time? I feel it. I will lay in bed. I'll put two pillows so I can watch TV, read, whatever it might be. And then I don't realize that, same thing you just said. And then you get up like, oh, what is going on? And then when I take one pillow away, I put my head down. It's like, oh, that's comfortable now. Um, so just to confirm, when we feel that pain, wherever it might be, even just from laying a certain way for a period of time, the pain is essentially from the stagnation of the blood.
Yes.
Oh
If
my
the
gosh.
pain is sharp, like what I experienced is so sharp you couldn't even move, couldn't turn. The sharp pain is blood stasis. But if the pain is dull, you feel kind of like a little bit soreness, a little bit achy, but not too sharp. That is the qi stagnation. So qi stagnation is a little bit better than the blood stasis because the pain is not so severe. But they both bad. They cause the pain, cause the discomfort.
Whoa. Okay. Are they both essentially proper flow of blood not taking place?
Yes, you can see that. Yes. The
Okay.
qi and the blood is supposed to move in our body continually, but because something we did wrong, then the blood kind of like stuck over there, or the qi stuck over there. That's why actually a lot of people who like they tend to worry, they tend to think about too much. These kind of people have like tight shoulder. The shoulder is tight, the neck is tight. Usually, these kind of people have kind of like shoulder pain or shoulder tightness, neck tightness. So yes, we we,
Hmm.
we, we all have a little bit of the stagnant.
I know it's hard to grasp it, especially when we talk about the chi in blood and try to, explain that. But, from our conversations, to me, it's the energy within the blood and the flow of the blood, the chi being good energy. I'm making this very basic, but would you say that that's a reasonable explanation of what that is, the chi?
Well, yeah, qi, most people translate qi as energy. So energy, right, push things, doing things, active. Yeah, blood, we know blood because we can see it, right? It has color, it's
Yep.
But qi is invisible. It's very hard to say. So people usually call it energy. So it's like, yeah, it's energy. Just like make people doing things. If you don't have any energy, you just cannot do anything. You cannot even get up from the bed. You just want to lying down over there. Like one of my friends said she experienced a lot of things, like her family stuff. She said she's so tired. She cannot even sit. She had to lie down on the bed to rest. So no energy. So in that way, she not only have the qi stagnation, but she also has qi deficiency. Basically means no, like not enough qi in her body to push the blood to keep her doing stuff even.
Final question, because we're just about out of time. Let's just say you're depleted. You're not taking care of yourself. You're not sleeping right. You're very tired. Would that also be just not enough chi in your body to move the blood properly?
Um, in general, usually when people have like shortness of breath, when people are very easily to fatigue, usually there are some qi deficiency. That's for sure. But are there any underlying problem like spleen or kidney deficiency?
Mm,
That could be. Yeah,
mm,
that's for sure.
forgot about that. Kelly121acupuncture.com is her website, located in New York City. Obviously, for acupuncture, you have to be there. We were just talking off air. I've got a friend dealing with a challenge who's not far from New York City. So I am referring Dr. Kelly as soon as we get off here with a text. But the other things in terms of Chinese medicine, virtual consults, even herbals, which changed my life. Kelly121acupuncture.com. Thank you again for all the insight today, Dr. Kelly. Really appreciate it.
Thank you, Steve.
We'll be right back.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.